Have you ever felt that sharp, radiating pain down the back of your leg? Or maybe your wrist feels numb and tingly, making even simple tasks unbearable? Sciatica and carpal tunnel syndrome are not just frustrating, they can completely disrupt your life. But here's the good news. Many cases don't require invasive treatments like surgery. Instead, they might stem from something surprisingly simple: nutritional deficiencies. Today, we'll uncover the three most critical vitamins for nerve health: B1, B6, and B12, and how they can help you combat nerve pain and discomfort. Stick around, because this could be life-changing. Vitamin B6, the protector of nerve integrity. Let's start with vitamin B6, also known as pyridoxine. Did you know B6 is involved in over 160 enzyme processes in your body? That's how vital it is. When it comes to your nerves, B6 plays two critical roles. 1. Building the myelin sheath. This is the protective coating around your nerves. Without it, nerves struggle to transmit signals, causing burning, numbness, tingling, or pain. 2. Producing neurotransmitters. These chemical messengers, like serotonin and dopamine, keep your nervous system functioning smoothly. B6 focuses specifically on sensory nerves, the ones responsible for sensations like pain, numbness, or burning. If you're dealing with sciatica or carpal tunnel syndrome, B6 is your nerve's best friend. But here's the catch. Not all B6 supplements are created equal. Most over-the-counter forms contain pyridoxine, which is inactive. Your body must convert it into the active form, pyridoxal 5-phosphate, P5P, in the liver. For some people, especially those with liver issues, gut inflammation, or certain genetic traits, this conversion doesn't happen efficiently. Why too much B6 can be harmful? Here's where it gets tricky. Taking high doses of inactive B6 can actually block the active form, causing symptoms of deficiency. Imagine taking a supplement to fix nerve pain, only to make it worse. To avoid this, always opt for the active form, P5P. Are you at risk of a B6 deficiency? You might be deficient in B6 if you have gut issues like celiac disease or Crohn's, take medications like birth control pills, consume lots of alcohol or coffee, follow a vegan or vegetarian diet. Plant-based B6 is less bioavailable. If you're experiencing nerve pain, consider adding B6-rich foods like fish and poultry to your diet. Or better yet, supplement with P5P. Vitamin B12, the myelin maker. Next, let's talk about vitamin B12, a powerhouse for nerve regeneration. If B6 protects the nerves, B12 helps build them. Its primary job is supporting the production of myelin, the same sheath we just talked about. Without enough B12, your nerves lose this protective layer, leading to damage, pain, and even irreversible issues. B12 deficiencies are sneaky. They can go unnoticed for years. By the time symptoms like numbness, tingling, or nerve pain show up, serious damage might already be done. Why are so many people deficient in B12? Here are the most common reasons. 1. Dietary choices. B12 is found in animal products like meat, fish, and eggs. If you're vegan or vegetarian, you're at a higher risk. 2. Low stomach acid. Conditions like acid reflux or gastritis reduce your body's ability to absorb B12. 3. Medications. Certain drugs, including antacids and birth control pills, interfere with B12 absorption. 4. Genetics. Some people have genetic variations that prevent their bodies from properly utilizing B12. If you suspect a deficiency, opt for the natural form of B12, methylcobalamin, instead of the synthetic cyanocobalamin. It's more effective and easier for your body to absorb. Vitamin B1, the carb metabolizer. Finally, let's explore vitamin B1, or thiamine. B1 is often overlooked, but it's crucial for metabolizing carbohydrates and sugar. Why does this matter? Because if your diet is high in carbs or sugar, you need more B1 to keep your nervous system functioning properly. The link between B1 and nerve pain. A deficiency in B1 often shows up as peripheral neuropathy, especially in people with diabetes or prediabetes. Symptoms typically include tingling or burning pain in the feet and hands, but they can also appear as sciatica-like pain. How to address a B1 deficiency. Certain lifestyle habits, like excessive coffee or tea consumption, can deplete B1 levels. To replenish your stores, try benfotiamine, a fat-soluble form of B1. It penetrates nerve tissues 25% more effectively than regular B1 and is excellent for supporting the myelin sheath. Practical tips to optimize your nerve health. If you're ready to take control of your nerve health, here's what to do. 1. Choose the right supplements. Look for the active forms of these vitamins: P5P for B6, methylcobalamin for B12, and benfotiamine for B1. Avoid synthetic or inactive versions. 2. Balance your diet. Incorporate foods rich in these vitamins. For B6 and B12, focus on animal proteins like fish and meat. For B1, include whole grains and nuts. 3. Tackle lifestyle risks. Limit alcohol, coffee, and processed foods. Address gut health issues and consider genetic testing if deficiencies persist. 4. Beyond vitamins, addressing structural issues. While nutritional deficiencies are a major cause of nerve pain, they're not the only culprits. For sciatica, a loss of the natural curve in your lower back could also be to blame. Nerve pain doesn't have to control your life. By addressing deficiencies in B1, B6, and B12, you can strengthen your nerves, reduce pain, and regain your quality of life. These vitamins are more than just supplements. They're tools for rebuilding and protecting your nervous system. So, don't wait. Start incorporating these essential nutrients today. And if you found this information helpful, be sure to share it with someone who might be struggling with sciatica or carpal tunnel syndrome. Together, we can spread awareness and make a real difference.